Hi, my name is Wang. I am an orthopedic spine surgeon at the Desert Institute for Spine Care. I grew up in Los Angeles in a suburb of Pasadena and attended Stanford University for my undergraduate. After that, I went to UCLA, back to Los Angeles for medical school, and then went back to Stanford for orthopedic surgical residency. I ended up moving to Phoenix in 2012 and then joining a spine surgery practice in which we were treating patients of all types of ages and pathologies, and ended up working with spinal fellows and teaching orthopedic and neurosurgical surgeons how to do specialty techniques in spinal surgery. Having personally known the surgeons at Desert Institute for Spine Care, I knew the caliber of their education, certainly the skill of their technical ability, and reputation for being good, both doctors and good listeners. Really, the goal for me has always been to try to do the smallest operation for the biggest reward. I think that's where we make the biggest impact in what we do. Minimally invasive surgery is something that I've been teaching residents and fellows for, like I said, over a decade. And really, it's a philosophy to start with, which is to try and do the least amount of trauma to get the maximum result. So being able to do that type of surgery has allowed our patients to recuperate much faster. Pain levels are much smaller. Requirements for narcotic use is much less. And so now we have patients leaving the hospital same day from spinal fusion, within 24 hours from spinal fusion, and getting the same results they would be getting years or months down the road within a few weeks. I think there's different philosophies for physicians, right? So most people have the preconception that a surgeon only wants to operate. And I think that for some surgeons that's true, but I think that for surgeons like myself, that's probably the polar opposite. The whole point of us being in this field is to educate our patients, educate them when they don't need surgery just as much as when they do need surgery. We see the gamut of patients, and I'll see patients who are still in high school with back problems related to sports, all the way to people in their 80s and 90s who still try to live an active lifestyle, and their back problems or neck problems are limiting their ability to even take a walk around the block. So we have to be comprehensive in the way that we treat our patients. We have to understand what their goals are and then sort of meet their expectations with treatment. I would recommend the Desert Institute for Spine Care because I think we provide very high-end surgical techniques, the most advanced, less invasive spinal surgery opportunities for patients in a setting where it's family-oriented. We listen to your issues and we work together to come to a solution.